8 symptoms of lung cancer that will shock you. Many people are surprised to learn that lung cancer remains the leading cause of cancer-related deaths worldwide. Despite decades of medical progress and growing awareness campaigns, this disease still claims more lives each year than breast, prostate, and colorectal cancers combined. What makes lung cancer particularly dangerous is not only its severity, but also how quietly it can develop. In many cases, the early warning signs are subtle, they may appear harmless, and they are often mistaken for ordinary problems such as fatigue, aging, or minor respiratory infections. Now imagine this for a moment. By the time you finish watching this video, you may be able to recognize several warning signals that thousands of people overlook every single year. Signals that the body sometimes sends long before a diagnosis is made. Lung cancer is considered one of the most serious cancers doctors encounter today. Part of the reason lies in its survival statistics. The 5-year survival rate for lung cancer is estimated to be around 22%. While treatments have improved over time, early detection remains the most important factor in improving outcomes. Every year, more than 2 million people around the world are diagnosed with lung cancer. Unfortunately, many of these cases are discovered only after the disease has already spread. Research suggests that a large percentage of patients do not recognize the early symptoms until the cancer has progressed into more advanced stages. But here is something many people find surprising. In numerous cases, the body actually begins sending warning signals months before the disease is detected. The challenge is that these signals often appear subtle and easy to ignore. They hide behind everyday discomforts that most people would never associate with lung disease. Your lungs are 2 large organs located inside the chest. Their primary job is to deliver oxygen to your bloodstream and remove carbon dioxide from the body. Every time you inhale, millions of tiny air sacs inside the lungs exchange gases that keep your organs functioning properly. Without this constant exchange of oxygen, the body cannot survive. However, because the lungs contain very few pain-sensing nerves, serious problems can develop without causing obvious pain in the early stages. This is one reason lung cancer can remain unnoticed for long periods of time. Understanding the body's warning signals can make an important difference. The more familiar you are with these symptoms, the more likely you are to recognize when something unusual is happening. In this video, we will explore 8 surprising symptoms that may be associated with lung cancer. Some of these signs may appear minor or unrelated at first glance. In fact, several of them are so common that many people experience them without ever suspecting they could indicate something more serious. You might even recognize 1 or 2 of them in your own life right now. Interestingly, recent studies suggest that when several of these symptoms appear together, doctors may have a better chance of identifying lung cancer at an earlier stage. And early detection can significantly improve treatment outcomes. Disclaimer: this video is intended for educational and informational purposes only. It is not designed to diagnose, treat, cure, or replace professional medical advice. If you notice unusual symptoms or have concerns about your health, always consult a qualified healthcare professional. Now, let's begin with the first warning sign. Sign number 1. A persistent cough that does not go away. One of the earliest symptoms of lung cancer can be a cough that gradually becomes persistent. At first, it may seem like nothing more than a mild irritation in the throat or chest. Many people assume it is caused by seasonal allergies, a cold, or exposure to smoke or pollution. However, a cough related to lung cancer often behaves differently from an ordinary cough. Instead of improving over time, it slowly becomes more frequent. It may linger for weeks or even months. Some individuals notice that the cough gradually becomes deeper or more forceful. Others describe a constant tickling sensation in the chest that triggers repeated coughing. This occurs because a growing tumor can irritate the airways. The irritation stimulates nerve endings inside the respiratory tract, which causes the body to trigger the coughing reflex. In the early stages, this symptom is easy to dismiss. People often assume it is simply a lingering respiratory infection. But when a cough persists longer than 3 to 4 weeks, doctors usually recommend further evaluation. Sign number 2. Coughing up blood. Coughing up blood, even in small amounts, is a symptom that doctors take very seriously. The medical term for this condition is hemoptysis. Sometimes the blood may appear bright red. In other cases, it may appear as dark streaks mixed with mucus. This symptom can occur when a tumor damages small blood vessels inside the lungs. Even a tiny amount of blood in the sputum can be an important warning sign. Many people initially overlook this symptom if it happens only once. They may assume the irritation came from excessive coughing. However, persistent or repeated episodes should always be evaluated by a doctor. Sign number 3, shortness of breath. Another common symptom of lung cancer involves changes in breathing. Some people notice that they become short of breath during activities that previously felt easy. Walking upstairs, carrying groceries, or even speaking for long periods. These everyday tasks may suddenly feel more physically demanding. This occurs because tumors can partially block airways or reduce the lung's ability to exchange oxygen efficiently. Fluid may also accumulate around the lungs in certain cases. This condition is called pleural effusion. When fluid builds up in the chest cavity, it can limit how fully the lungs expand during breathing. As a result, the body struggles to receive the oxygen it needs. Sign number 4, chest pain. Chest discomfort is another symptom that doctors evaluate carefully. Unlike the sharp pain associated with injuries, lung cancer pain often appears as a dull or persistent ache. It may occur in the chest, shoulders, or upper back. Some people describe it as a pressure or heaviness in the chest. This pain can develop when a tumor presses against nearby tissues, nerves, or the lining of the lungs. In certain cases, the pain may worsen when taking a deep breath, coughing, or laughing. Because chest pain can have many possible causes, it is sometimes difficult to identify the exact reason without medical testing. However, persistent chest pain should always be discussed with a healthcare provider. Sign number 5, unexplained weight loss. Many types of cancer can lead to unintended weight loss. Lung cancer is no exception. Some individuals notice that they begin losing weight even though their diet and activity level have not changed. This occurs because cancer cells require large amounts of energy to grow and divide. They compete with healthy cells for nutrients. As the body redirects energy toward fighting the disease, weight loss may gradually occur. In addition, lung cancer can affect appetite. Food may begin to taste different. Some individuals simply lose interest in eating. When weight loss occurs without an obvious explanation, doctors often consider it an important signal that requires further investigation. Sign number 6, persistent fatigue. Fatigue associated with lung cancer is often more intense than ordinary tiredness. People may feel exhausted even after a full night of sleep. Simple tasks such as walking, cooking, or doing household chores may suddenly require much more effort. This happens because cancer places significant stress on the body's metabolism and immune system. The body must constantly work to manage inflammation and repair damaged tissue. Over time, this process can drain physical energy reserves. Cancer-related fatigue often develops gradually. At first, people may attribute it to stress, aging, or lack of sleep. But when exhaustion becomes persistent and interferes with daily life, medical evaluation becomes important. Sign number 7, repeated respiratory infections. Some people with lung cancer experience frequent infections such as bronchitis or pneumonia. These infections may seem to occur repeatedly within a short period of time. The reason is that tumors can obstruct airways. When airways become blocked, mucus can accumulate in the lungs. This environment allows bacteria to grow more easily. As a result, infections may develop more frequently than usual. Doctors often become concerned when respiratory infections return again and again despite treatment. Recurring infections can sometimes signal an underlying structural problem within the lungs. Sign number 8, hoarseness or voice changes. Changes in the voice can also be linked to lung cancer. Some people notice that their voice becomes hoarse or weaker than usual. Others describe a rough or raspy tone that persists for weeks. This symptom may occur when a tumor presses on the nerve that controls the vocal cords. This nerve travels through the chest near the lungs before reaching the voice box. If it becomes irritated or compressed, the vocal cords may not function normally. As a result, the voice can change. Many people assume hoarseness is caused by a simple sore throat or overuse of the voice. However, when voice changes last longer than 2 or 3 weeks, doctors often recommend further examination. Understanding these 8 potential warning signs of lung cancer may help increase awareness. Recognizing unusual symptoms early and seeking medical advice when they persist can play an important role in earlier detection. If you found this information helpful, consider liking this video and subscribing to the channel for more science-based health insights. There are additional videos on the screen that explore other important health topics you may find valuable. Your support helps share life-saving health knowledge with people around the world.